Okay, today we're going to do a barium enema, and barium enemas are done for a number of reasons. They look for diverticulum, polyps, and inflammation of the colon, and it can be done with a double or single contrast, double meaning barium and air, and single meaning just barium. They can also use gastrographin. It's a different type of iodinated contrast. And that's used if a patient has a perforation or pre or post-op, and it also could be used for therapeutic purposes. And so now I'm going to talk about the patient prep. Patients go through a cleansing of the colon before they get this done, and usually they will have a clear liquid diet for 2 days, some laxatives, even a suppository, and sometimes even a cleansing enema before. Okay, here I am. I'm going to set up for my BE, get my supplies ready. We're going to need our gloves, tape. We're going to put a chuck down on the table. We're going to get extra towels and washcloths, some lubricating jelly for the tip, and hemostats to secure the airline. And then we're going to get our barium bag ready. BEs will use 75 to 95% weight per volume barium and about 1,500 milliliters, so it'll be a little bit more than half full. We're going to get ready, and we're going to get make sure our tip, our cuffing plate's on the tip. That looks good. And then just going to get the air infuser ready. Good. And then we're going to set up our room. Okay, so I'm going to prep my room. I laid my chuck down on the bed. My Bucky is down at the bottom in the parked position, and the x-ray machine is in the corner in the parked position, so the fluoro can be used. Okay, so now I'm ready to go get my patient. Hello.
Hi.
And can you tell me your last name?
Kleinhammer,
And your date of birth?
9/17.
Okay, perfect. Go ahead and sit up on the table. We're just going to talk a little bit right now. My name's Andrea. I'll be doing your exam today. Can you tell me a little bit about why you are having this done?
I'm just having some lower abdomen pain.
Okay. And how long has that been going on?
About a month.
A month? Okay. Have you had any surgeries?
No.
Okay. Any allergies that I should know about?
No.
Okay. Is there a chance you could be pregnant?
No.
Okay. Any medications that you're taking right now? Okay. So you've never had one of these exams before?
No.
All right. Basically what it is a barium enema. We will be putting contrast up through your rectum to look at your colon. And we'll be doing a couple different pictures, and we'll have you rotate and just some other pictures. And we'll also get another one once you evacuate everything. Do you have any questions for me?
No.
Okay. So she's going to roll onto her left side, and her right leg is going to go in the front. This is the Sims position. And from there, I'm going to get the tip ready, and I'll insert it rectally about 3 to 4 inches and pull up the cuff just a little bit so it stays in place. Well, then the doctor will come in and instruct me when to let the barium flow through, and he will get all of his images with the fluoro. And the barium cannot be more than 24 inches above the table, and usually it's a little bit warm just so it's easier for the patient to take. Also, the doctor might insert a little bit of air if it's a double contrast study. So now I'm ready to take all my overheads. We're going to start with a regular KUB, centering at the crest. The next one would be an AP axial, so I will center at the as-is, and I'll angle my tube 30 to 40 degrees cephalic. The next one would be an RPO, so she'll kind of oblique her body to the right, about 45 degrees, and I'll center at the crest again. The next one would be the opposite, LPO, so I'll oblique her 35 to 40 degrees and center at the crest again. The next one I would do is a left lateral. So she'll go all the way up onto her left side, and I'll center at the as-is. From there, we would do our D-cubes, and those are shot cross table, so the film would be at her back. And the centering for that would be at the crest as well. So that's her left D cube, and then we'll go to her right D cube. A lot of moving around here. And again at the crest, the next one that we would do would be a lateral rectum. So she's going to go all the way onto her stomach and be prone. We would then remove the tip. Prone, we would remove the tip and shoot a cross-table rectum shot that would be centered at the greater trochanter. And again, the film is on this side. And then the patient would go evacuate, and she would come back and be supine, and then it would just be another KUV centering at the crest. So for all the overhead images, my KVP is anywhere from 90 to 110 to be able to penetrate the barium. The mass is around 30 to 70 depending on the size of your patient. Also, the laterals, you're going to go increase your mass. So now that we're all done, before I let my patient go, I'm going to give them some aftercare instructions. I'm going to let them know that barium can cause constipation and that their stool can be a little discolored. So I'll let them know to drink plenty of fluids for the rest of the day so that all the barium can be flushed out. Okay, so we're going to evaluate some of our images for the scout view that we do beforehand. It's just to make sure that the patient is cleaned out. Also tells you where to center on the patient for when the barium's there. A technique for this would be about 80 kVp and anywhere from 20 to 70, depending on how big they are, mass. Let's see. Our next image is just another AP with all the barium in it. It shows the entire colon. And then we go to a left lateral DQ. This will show air fluid levels. As you can see, the line where the barium is. Shows pretty much the entire colon. Luckily, this patient was small enough to get it all on one. And then a right lateral D cube shows just the opposite side of the colon. They do a lateral rectum shot here, and shows basically the rectum and the sigmoid colon. And then they also do a post-evacuation film. Some other pictures that they can do are the PA or AP axial, that would show the sigmoid colon. They can do RPO, LPO, RAO, or LAO, that would show both of the flexures. They can also do just a regular left lateral for the entire colon, and also the Chasser-Lapine axial method, which looks at the recto-sigmoid junction, and it shoots through the lumbosacral region, and that one is done post-evacuation.